Tuberculosis, also known as TB, is a bacterial infection caused by Mycobacterium tuberculosis, which is an obligate pathogenic bacterial species. Tuberculosis is the most common infectious disease in the world, infecting 1 out of 3 people. It also has the highest global mortality rate, killing 1.7 million people in 2009. There are 2 different types of tuberculosis, latent and active, and we will go into more detail about what makes them different later on. Some at-risk populations for contracting tuberculosis are healthcare workers, individuals with HIV or end-stage renal disease, intravenous drug abusers, alcoholics, and individuals traveling to areas of the world where TB is endemic, like India or Asia. African Americans, immunocompromised individuals, and diabetics are also at high risk for contracting TB, as well as people living in close quarters. A person will become infected with TB when they inhale airborne droplets containing the M. tuberculosis bacilli that were coughed or sneezed into the air by someone with TB. These droplets pass down the airway into the bronchial tree and the apex of the lungs. In a normal, healthy individual, lack of infection in the lungs results in no respiratory or cellular abnormalities. For patients with latent TB, the bacteria are not active and do not multiply, but could become active in the future. 5 to 10% of patients with latent TB could develop active TB later on. For patients with active TB, on the other hand, the bacilli will begin to multiply and make the lung tissue inflamed. White blood cells and pulmonary macrophages rush to the infected area and set off an immune response to contain the infection. A lesion, called a tubercle, is then formed, made up of white blood cells, bacilli, and fibrotic tissue. Scar tissue will eventually grow around the tubercle and deactivate the bacilli. Stimulated macrophages continue working against the bacteria, releasing enzymes that also damage lung tissue and cause necrosis, which results in the lung tissue looking like Swiss cheese. Patients with latent TB are asymptomatic, do not feel sick, and can't spread the infection to others. Those with active TB have a productive cough lasting at least 3 weeks. They will cough up blood or sputum, have chest pain, weakness, fatigue, weight loss, and fever. They are also able to spread the TB infection to others through airborne droplets. Latent TB diagnosis includes skin or blood tests indicating a TB infection, while active TB shows an abnormal chest x-ray and a positive sputum culture in addition to the positive skin or blood tests. Various factors such as latent, active, or drug-resistant TB impact the prognosis of the disease. Thanks for watching.